A common complaint as we age is that our joints seem stiff and we can't get around as easily as we used to. One reason for that could be osteoarthritis. According to the Arthritis Foundation, osteoarthritis is common in all races and backgrounds. It usually appears after age 45. Men under age 55 are more likely to have OA than women in the same age range. After age 55, however, women are more commonly affected. Overall, more women have osteoarthritis than men. The specialists at Florida Hospital Waterman's Joint Replacement Center explain why, with today's surgical options, there is no need to let joint pain interfere with an active senior lifestyle.
In this area, most people think it's an older community, but I would say in the last several weeks alone, I've probably done 2 hip replacements in people that were younger than 45. And I mean, it can be obviously up into the 80s. And a lot of the people in this area are very active. So I try not to discriminate against a patient because of their age. It really depends on their health issue. Now, obviously, it gets to a point where you may have diminishing returns, but I mean, I have a lot of patients in their 80s that have hip, knee, shoulder replacements, and they do just as well as some of the younger patients.
Minimally invasive surgery, which basically means small incision surgery, has really taken off over the last 8 to 10 years. But what's driven minimally invasive surgery is the need to get patients out of the hospital quicker. And it's interesting because looking back at it now, it's completely common sense. Of course, you want to have smaller incisions so they don't bleed as much, because bleeding more causes more potential problems. When you make longer incisions, people hurt more. It's harder for them to get out of bed. It's harder for them to do the rehab. So it just goes on and on. And when you're able to do these smaller incision surgeries like this, you're reducing blood loss, you're reducing soft tissue damage, you're being able to get them up and going much quicker, combined with the better ways that we're able to control pain nowadays. It ultimately just leads to a quicker return to normal function. It's not unusual to have some of my patients driving a car 3 weeks after a total knee replacement. They're doing that well that quickly.
That is our #1 goal. Our goal is to try to get them back to golf or any of the other activities that I mentioned as soon as possible. And a lot of people tend to think that, oh, I'm having a knee or hip replacement, it's the beginning of the end. And I think we've done a lot to try to reverse that, because most of the patients we can get, even after a knee or hip replacements, most of my patients, even the golfers, get back to playing golf within 6 weeks after the procedure, sometimes less than that.
We've included the link for more information on osteoarthritis, along with contact information for Florida Hospital Waterman's Joint Replacement Center when you click the Aging Joint Story icon on yourhometownhealth.com.